Good evening, everyone. Welcome to the Fireside Chat, a live session with our beloved doctor volunteers. Project StepOne is a 100% volunteer-run free telemedicine service. Currently, 15% of India's home isolation patients for COVID-19 are receiving relief through our home isolation monitoring service in Delhi, Punjab, Bihar, Uttarakhand, Puducherry, Mumbai, Pune, Nagpur, Satara, Sangli, Bangalore, and Cuddalore. And all of this is only possible because of the 7,000 plus doctors and more than 1,000 citizen volunteers that we have. Hi everyone, I'm Shivangsha and I'm a citizen volunteer at Project StepOne. Today we have Dr. Jyoti Malik, Dr. Nilima Kadambi, and Dr. Gitanjali Monee with us. Let's hear a little bit about them from them. Dr. Jyoti, let's start with you.
Good evening. I am Dr. Jyoti Malik. I have done my PhD and diploma in naturopathy and yoga from Delhi. Presently, I am living in Goa. I am attending quarantine patients of Delhi, Punjab, and Maharashtra from last 3.5 months. I have attended more than 2,300 patients. I am also into plasma counseling of COVID negative patients. I love driving in the greenery of Goa. I love listening to music and cooking for my children. Thanks.
I'm already jealous of thinking about where you live, Doctor. It's great to know that you're helping us out from Goa. We have next Dr. Nilima. Can you tell us a little bit about yourself and your life outside StepOne as well?
Sorry, I seem to be having a little technical trouble. Can you go on to the next doctor? I'll just rejoin.
Sure, Doctor. Dr. Gitanjali, it would be great if you could tell us about yourself.
I'm Dr. Gitanjali and I'm a gynecologist. I'm practicing in Janakpuri, Delhi, and I'm associated with StepOne since June 2020. And I've attended about 2,000 patients through StepOne. And I love traveling and cooking. At present, due to quarantine, due to this pandemic, I'm restricted to my home. And so I'm just doing my household work and cooking. That's what I enjoy. And I'm through StepOne, I'm helping the COVID patients as I cannot go out.
2,000 plus patients, which is a great number. And thank you. We are indebted to you, Doctor. We have Dr. Nilima back with us. Dr. Nilima, it would be great if you could tell us a bit about yourself as well.
Hello, everybody. I'm Dr. Nilima. I live in beautiful Bangalore, and I'm a pediatric surgeon by qualification, but I'm more into holistic well-being now, especially emotional well-being and physical, mental, everything combined. And I'm so happy to be here today. I enjoy my work with StepOne, and besides being a doctor, I love to read, write, sing, and dance.
Really nice to know, Doctor. Multi-talented doctors. We have such great pool of volunteers here. Our topic today mostly predominantly covers home isolation, and let us start the topic with the first question for Dr. Jyoti. Dr. Jyoti, under what conditions are COVID-19 patients asked to stay at home under home isolation?
For home quarantine, we are following patients who are mildly symptomatic or asymptomatic. Mildly symptomatic means loss of smell, loss of taste, no difficulty in breathing, mild fever, headache, malaise, or slight cough or irritation in the throat, or sometimes loose motion. Not more than 4 loose motion or 6 loose motions. And according to age criteria also, when we see a patient is above 60 and he does not have any comorbidities, he can stay for home quarantines. And even for the people below 60 years of age, the patients who are below 60 years of age, if they are not having any comorbidities, and their comorbidities like diabetes and hypertension or any kidney lung related or cancer disease is under control, then we advise for home quarantine with mild symptoms.
Okay, Dr. Jyoti, what is the common advice that you give across the patients that you interact with who are qualified for home isolations?
Like firstly, when I call them, I ask them, do you have a separate room at home? You need a separate room and a toilet for home quarantine. Then I ask about them, about how many family members are there, and if needed, like if they are having a common toilet, we ask them to go to a COVID care center. If all of them are positive, then we advise them accordingly. Then we monitor their oximeter reading, their any difficulty in breathing, any kidney, lung related diseases, and mostly I advise them according to their diet. Like say I say take more of citrus fruits, more of protein, and protein also I keep in mind. Okay, there should not be any on renal disease. And I also ask them if it is a diabetic person, if his sugar is under control, if there is loss of smell or taste, and if it is too much of cold, we ask them to take steam or do gargling. And if they are feeling breathless and any anxiousness is there, accordingly we ask them to do breathing exercises. If in case of loose motion, I ask them to take curd rice, curd poha, and ORS. If ORS is not available, नींबू नमक चीनी का पानी लीजिए. Like these are the things I always keep in my mind.
Very important, doctor. Very important to note that diet and monitoring are some of the most important things for people who are in home isolation. Dr. Gitanjali, my next question is for you. In your area, can a pregnant woman stay under home isolation until which month of pregnancy can she stay safe at home? Dr. Gitanjali, you're on mute.
No, I'm not mute. I don't
Yeah.
know. Just
Okay, we can hear you now. Doctor, we can hear you now. Doctor, until Dr. Gitanjali, hello? Until Dr. Gitanjali can be with us with her audio, let me ask my next question to Dr. Nilima. Dr. Nilima, you're a pediatric surgeon. Dr. Nilima, can we discuss newborn care during home isolation?
Sure. Am I audible?
Yeah. Yes, you're
Yeah.
audible, doctor.
So a COVID positive mother who delivers a newborn baby is always anxious about her newborn's well-being and her safety, as well as even a non-COVID positive mother going to a hospital for a delivery, can she or the baby could get infection because COVID is such a infectious disease. But maybe it's just God's grace and also the universe protecting the most vulnerable newborns. The symptoms among children are very low relatively, and complications are almost nil, except for those who are born with other challenges and then they're more susceptible to the problems. So, more or less, what I advise is even if the mother is positive, she can continue to give care to her newborn baby and take precautions like using a mask, etc. And breastfeeding becomes very important because that's the best immunity that a newborn gets from the mother's milk. And if the baby is positive, as long as they're monitoring the temperature and vital signs, you can't really do a pulse oximeter on the little fingers, but general activity level, feeding, and everything, if it's good. And if they can keep a teleconsult with their pediatrician, it's perfectly fine to be home isolation, and mother and child is treated like one unit. But at the earliest sign of any complication, like the child is not feeding well or is not active or not alert or not responsive, it's important that they do take to a pediatric care unit.
Very important things to know that you have mentioned here, doctor. But newborns can neither be kept under complete isolation from their mother or the caregiver, nor can be made to wear mask. In such a case, what kind of precautions can the mother or the caregiver do to stop the spread?
So typically in a home, a newborn care is not just the mother, the grandparents and all are involved. But in case of COVID, it's like I suggest that the mother and baby is treated as one unit, and they don't pass the child to others for the caregiving. The others just support the mother in isolation with the baby in a separate room. And that's how you can prevent spread within the family and community. but the mother has to have that confidence of being able to do it. And if she's not, or if she's very anxious, then it's okay for another caregiver who is not a very high age person, like an elderly person or a comorbidity having person, to also be part of the caregiving process with due precautions like mask and other things. But honestly, I think the well-being of the baby is best when served when it's with the mother.
Very true, Doctor. Dr. Gitanjali, I
Yeah,
hope you're back with us and we
yeah.
can hear
Can you
you.
hear me? Yeah, can you hear
Yes,
me?
Doctor. Yes,
Okay.
Doctor, we can
Fine,
hear you.
fine, fine.
Yeah, great to have you
Yeah.
back. Doctor, can pregnant women stay under home isolation? And until which month of pregnancy is it safe to stay at home?
See, the clinical manifestations in pregnant women are not different from the other rest of the population. Like 80% of the rest of the population can easily be treated at home. Same is the case with pregnant women also. So all those pregnant women who are mildly symptomatic or asymptomatic or do not have any comorbidities can be easily home isolated, and they can be home isolated up till the labor sets in or till their delivery date. And if they have any comorbidities like they're diabetic, hypertensive, obese, and with comorbidities they are symptomatic, then they need to be admitted. Otherwise, they can be home isolated easily and safely.
Thank you so much,
Dr.
Doctor,
Govind,
for
I would like to
clarifying
add
the
to what,
many.
if I may just add a small point, Dr.
Sure, Doctor,
Gitanjali has
please.
very correctly said that a pregnancy is not really an illness, it's a physiological thing, and therefore they are treated like every other adult, healthy adult who would be tested positive. But these days, because not all hospitals and obstetric practitioners do take in cases who are COVID positive, it's also important that that lady lies with
She
that
has
lady, a doctor who's giving her the antenatal care, to make sure the hospital will accept when she's in
no,
labor because
no,
she's COVID
they'll
positive,
be going
and
only
not
to the COVID
able to
positive
be admitted to
hospitals.
another COVID care.
Sure, Doctor. Dr. Gitanjali, what are the modes of transmission to the fetus and what's the effect of COVID on fetus?
See, the modes of transmission, very rarely it is seen that at birth the baby is positive, so the vertical transmission does occur, that transplacental transmission, though it's very rare, but it is there. And secondly, the baby may get infection through respiratory secretions after birth, but it is not spread through vaginal secretions or through breast milk. So we can easily go for normal delivery, and the baby can be breastfed after delivery. And cesarean is indicated only when there's an indication for cesarean. COVID is not an indication for cesarean. So routes of transmission to babies either transplacental or through the respiratory secretions of the mother or any other infected person.
Thank you so much, Doctor. There is so
And
much to discuss about.
so you had asked one more question. Sorry, I forgot what was the question.
The question was, what could be the effect of COVID on the fetus?
Mostly fetus does not have any effect of COVID. As such, COVID virus is not teratogenic. So even if the baby gets the infection, like till the present studies, I don't know, further studies may, we'll come to know like from further studies something else, and these present theories could be defied. But at present, if the baby gets infection in the intrapartum period, there's no effect on it, no teratogenic effect. And even if after delivery the baby gets infection or during intrapartum period, the symptoms are very mild or asymptomatic and they recover very well.
That's such an important point you've made, Dr. Gitanjali, and it's important to reassure these pregnant women who we counsel while telephonically talking to them, because they have heard of the serious negative effects on the baby
No.
with other viral infections, and they are always anxious. So it's so important that you made
Till
this
now,
point.
there's no indication of medical termination of pregnancy, even if the patient conceives in the first trimester. It's not teratogenic, and pregnancy can be continued safely till then.
In fact, on a lighter note, I believe we are going to see a increase in birth rate across the world because of home
Yeah,
isolation.
but there's another. I don't know whether I know it's of this topic. I just wanted to share. It's being said that it may cause oligospermia in males. In young males who are getting infected at present, later they may develop oligospermia. It's been like after they did in New York, they did a few biopsies
Yeah,
in
I read
autopsy,
that
and
in
they
a,
found that
I
it's
did
leading
read
to
that article. It's
oligospermia
linked to sudden drop in
and
testosterone levels
drop in
in adult
testosterone
males.
and raise in LH hormones levels in male. So we may see a spurt of male infertility after a few years.
Okay, thanks for explaining it in layman's term because I was starting to wonder what exactly does that mean. But besides that, there are a few situations that a lot of home isolation patients are in, and it would be great if you could help our audience understand what to do in such situations. So, for example, if a patient is below 60 and has comorbidities, but has some movement related disability and is dependent on a caregiver, can they be home isolated? Dr. Gitanjali, could you please answer that?
Sorry, could you just
I
repeat the
will
question?
repeat
I'm
the
very
question
sorry.
for you. Yeah, I'll repeat
I
the
was,
question for you. If the patient is below 60 and has
yeah.
comorbidities but has some movement related disability
No,
and that results in caregiver dependency on caregiver, so can such person be isolated at home?
yeah, if the caregiver is ready for his giving his services, then the any person who's less than 70 has comorbidities but is mildly symptomatic or asymptomatic can easily be home isolated. Only while the caregiver has to wear mask while attending the patient and the caregiver both should be wearing masks, and the caregiver should maintain proper hand hygiene and should wash his hands properly before and after touching the patient, and should not touch anything, minimum contact to the surface also, and such patient can be easily home isolated provided the caregiver is ready to give the his services.
Just to
Very
add to that,
important to note.
many times I have seen home caregivers are from some agencies, and they often have one for the day, one for the night, and these people go up and down. But in a COVID positive case, it's mandatory that that caregiver has been exposed, so he has to be in quarantine. So that person staying in that home and taking care makes sense for 14 days.
Or it
Okay.
better if family members become caregivers. That would be more
But
better.
usually the caregiver would have been exposed anyway, so they have to care for the caregiver also.
True. Dr. Jyoti, the next question is for you. If a patient is above 60 and has comorbidities but is not suffering from breathlessness or high fever, so basically it's an asymptomatic patient, could they be home isolated?
Yeah, it
Above
depends on
60,
the
asymptomatic.
comorbidity patient is suffering from. Like if a patient is suffering from a diabetes, again, I'm just giving an example. If the sugar is under control, or if he is a hypertensive patient, if the BP is under control, even the cancer patient whose disease is under control, the comorbidity is under control, and they are asymptomatic or with mild symptoms, they can stay at home. Recently, I interacted with a lady who was on dialysis, and she was totally asymptomatic with very low grade fever. She was at home, so I guided her with the precautions she has to take at home, and she was okay.
In case of people who
Okay.
are home isolated with comorbidities, it's important that they have all the gadgets like a pulse oximeter, a
Oximeter,
thermometer, BP
thermometer,
apparatus, a glucometer, so that they can self monitor. And I often suggest when we do the counseling, because we won't have daily contact with them, that they should actually do teleconsults with their family doctor or their normal physician who treats them, so that they can have regular follow ups during the 14 days. And at any sign of adverse outcomes, so they can easily be hospitalized under the care of that same doctor if he's in touch.
In Delhi government is providing pulse oximeter to every patient for 10 days, first 10 days. So every patient has a pulse oximeter. They're getting pulse oximeter through the government.
No, but they need
even in
glucometer, they need other
No,
things also. If
other
they
thing,
need
matlab
to,
mainly, yeah, they should have mainly pulse oxygen, like oxygen.
self-monitoring
Their
devices
government
are
is
very
providing.
important in
Yeah.
home isolation. Yes.
Punjab,
Very important to have.
Even in Punjab, ASHA workers are coming on daily basis for first 11 days to monitor the pulse with pulse oximeter and thermometer if a patient cannot afford it.
Excellent service.
So it's very good to know that a lot of states are proactively doing the monitoring, and it's just we are all trying to do what we can, and the government is also doing that. That's good to know. And we have started getting questions from the audience, and I would like to begin with the first question. Dr. Jyoti, if multiple members, let's say a family of 4 or 5, and all are COVID positive, all are asymptomatic, can they stay in home isolation?
Yes, they can stay in home isolation. But like in a bedroom when they're sleeping in the night, if possible, they should keep a gap between the two beds because in the night when the room is closed through breath, the symptoms can increase through our secretions. They can stay at home if all of them are asymptomatic.
Good to know. Good to know that if all are asymptomatic and it's a small, whether it's a small house or large, and all are positive, they can continue staying at home. The
They have a
next
common
question,
toilet. Excuse
yes,
me, if they
doctor.
have a common toilet, they practice to sanitize the toilet every time the person is using. The second person should use at least 15-20 minutes of the toilet because every household is not having a personal toilet for everyone. If all the 4 or 5 are asymptomatic and living in the house, so they should sanitize the toilet after using.
The next question is we received is if a few members of a family are COVID positive and rest are not, should the ones who have tested negative be actually sent to live with another relative or sent out?
They shouldn't. No, they shouldn't be sent because you never know. They must be inactive, but they could be in the latent phase, and because the result does not come positive immediately. It comes. The incubation period is from 2 to 14 days, so it can be positive. It can take 2 to 14 days to come positive. So they shouldn't be sent to their relatives' house. They may be infecting them also. It's better that the person who's positive should be isolated in a different room if they have a facility of a different room. And the patient should. It's ideal that the patient should have a different room and a different toilet. And if that's not possible, they have less rooms or there's no facility for home isolation at home. The patient should be shifted to a COVID care center, not the people who are negative, because if they could be positive and it could be they haven't and a result hasn't come positive yet and they could be infecting other people also, so they should be staying there and the person should be isolated either at home or in a COVID care center.
Sure, doctor. Next question we have is a pediatric question. So, Dr. Nilima, this one is for you. If a mother is COVID positive and has a toddler dependent completely on the mother, what precautions can be taken to protect the child?
A toddler who's not physically dependent on the mother for, let's say, breastfeeding or anything, but is actually clinging to the mother because that's how usually children are at that age, then it has to be again assumed that that child has been exposed. But to protect the child, it would be great if the father, who's the other closest, could take on the caregiving and let the mother get the full rest that she needs to recover from the COVID infection in a separate room. But if it's just not possible, then making it like a game where the mother says, okay, you're all going to play like, we're going to wear masks because the toddler can't be explained things, but making it like a game and ensuring maximum possible care to prevent transmission. But other thing is, if the child is in contact with the COVID positive mother, then it's important that the child doesn't run around to the grandparents and others because then the whole family will get exposed. Children by far, because they have been immunized and other things, unless they have some other health issue like asthma, they are pretty safe from COVID symptoms. And if they become positive also, it's not such a big deal. But they can act as spreaders within the family or playing in neighborhood children. So that's where the precaution is more important.
Thank you so much, Dr. Nilima. That was those were some really interesting ways to engage a toddler and keep the toddler safe at the same time. We have another question from Pooja Saligrama. What are the effects of COVID treatment and drugs on the fetus? Dr. Gitanjali, I would repeat. I would like you to answer this question. Let me just repeat it one more time. What
Yeah,
are the effects of COVID treatment and drugs on the fetus?
see, in the mildly symptomatic patients, we are just giving symptomatic treatment. We are giving antipyretics, we are giving anti-allergics, and we are giving maximum azithromycin. And these, yeah, hydroxychloroquine, these medicines can be safely given to a pregnant lady. They do not have any effect on the fetus. And once if the patient gets moderate to severe symptoms and the patient is hospitalized, we have to give her remdesivir. Remdesivir is not advised to a pregnant lady, but being a life-saving drug, if the patient is serious and we have to save her life, that time we'll not think about the fetus. That time the mother's life is more important. Then we'll give all the medicines which are to be given, because that time the patient's life is more important. And what effect it will have, just
Unlike
now
what they show in
it is
Hindi movies.
a new infection, and every day doctors are also knowing new things about it. So exactly what the effect will have of the medicines will come later, once the child has been born, and when further studies have been done. What like if remdesivir is given or tolikazulam is given, all these drugs, what effect they'll have, we'll come to know later. But if needed, then they will be given, because patient's life is more important than the fetus at that time.
Just as I was saying, though they show in the Hindi movies, बच्चे को बचा दो,
That you
कोई
say,
कोई
मैं नहीं
बचा के
लूं,
रख
मैं
लो.
नहीं
Medical
लगाऊंगी.
ethics is
It's
very
not
clear.
like that. And
Primary life is the mother. Everything will
most
be
of
done
the
to protect both, but otherwise she takes priority.
most of the medicines do not have such severe side effects that we cannot give them. Life-saving drugs are to be given.
Very important to note that case to case, probably the treating doctor would have, suggest what kind of drugs can be given to the pregnant lady. But thank you so much for clarifying that it is safe to take most of the medicines. The next question that we have, Dr. Nilima, for you, what are the investigations required for elderly patient with hypertension and mild symptomatic patients at home isolation?
For older patients who are diabetic or hypertensive, it has been seen between the 7th to 12th day, very often the controls go haywire. Sudden dip in sugars is more dangerous, or even high sugars. And they are also more prone to the respiratory complications. And therefore, blood tests for D-dimer levels, as well as a HRCT, as we call a high resolution CT of the chest, is often done on the 5th day or 9th day to evaluate the progress of such patients. But most of the time, if they are not under well control of comorbidities, it is safer that they are in a hospital, so that immediate action can be taken then and there by the treating doctor for any additional investigation or additional treatments that may be necessary.
Thank you so much, Doctor. Very good point to note here that observation, monitoring of health condition is very important thing. Dr. Jyoti, I have a question for you from another audience. How do families take care of household work like cooking, cleaning, etc., if one or more patients are positive and the rest of the family aren't? Because a lot of times in Indian household, the head of the family is dependent on a few things, or the lady of the household is dependent on, probably the cooking and the kitchen work. So when someone like this is positive, then what can be done, and how can the family deal with this situation?
You're muted.
Dr.
Jyoti,
Jyoti,
unmute
you're
yourself.
muted. Yes, thank you so much.
No. Can you hear me?
Yes, doctor, we can hear you.
Can you? Okay. In these cases, I have often spoken to ladies. जैसे हम तो क्वारंटाइन में कमरे में अलग हैं, हमारे हस्बैंड को तो खाना बनाना ही नहीं आता है. So I said, you don't have any option. You have to stay separately in a room, and your husband and the family has to manage by their own self. Otherwise, it would be a vicious circle if the lady enters the kitchen for cooking, and the virus would be spread in the whole of the family. We don't have any option only. The lady has to be in a separate room, quarantined with a separate toilet. This question has been asked to me multiple of times during the quarantine period. This is what I have explained. And I laugh with them. I say, in this way, your husband will also be trained.
To Dr. Jyoti.
But we have to.
Some other practical solutions are that family and friends who are not staying in the same house can supply at the doorstep some food. And for bachelors, I often say
But
you can use Swiggy, but please order healthier foods, something like dal chawal or pongal or idli, rather than some non-veg biryanis and stuff.
Dr. Nilima always suggesting healthier options as usual.
Yeah, but some say that we don't add that option only. People are not ready to talk to us. Neighbors are not ready to communicate with us. And some are facing social stigma also. This is really bad. People are not able to understand by giving any family a social stigma. This is not correct.
So I think the good news is, thanks to the pandemic having got prolonged and the media hype getting less and rules and regulations also coming in, now I see more of compassion and empathy and helpfulness.
And most of them are helpful. Most of them
True,
are
doctor.
helpful.
Even I think the trend is changing, and the trend started changing a couple of months ago with a lot of myths getting busted. Also, a lot of places there have been helplines set up by government saying that if you face any social stigma or if your neighbors are troubling you, because we have seen on StepOne that many callers call and tell that my landlord is asking me to vacate or things like that. So government has a lot of governments have put up helplines where the patient can call and get some sort of a help and get some sort of an intervention when such cases occur. So I think we do not have any further question and answers. So before we close our chat for the evening, I would like our doctors, the three of you, to share your experience of working with StepOne and any message that you have for the audience, your friends, and your family. Dr. Jyoti, can we begin with you?
Yeah. Life in StepOne quarantine monitoring is full of daily learning. I get to know so many new experience and I learn every day and I love it a lot. And when we give solution telephonically to the patient on the other side, it gives me a lot of satisfaction. And secondly, I feel during the hours of pandemic, I am giving a service to nation. It satisfies my soul also. So I request all the doctors who have not volunteered till now to give a missed call on a phone number 080-471-92219 and join the StepOne and enjoy the new learning process.
True, doctor. We are displaying this number. You can see this. So, any doctors who would like to help the nation, please do give a missed call to this number. Dr. Gitanjali, it would be great if you have any message. Please, could you tell our audience that?
You need to unmute yourself. Please unmute.
Yeah, Dr. Gitanjali, you're unmuted. Can you?
Am I audible?
Yes, you are, doctor.
Okay, fine. See, due to my medical condition, I was not able to go to the hospital. I've not been going to the hospital since 13th March. So I was at home, and when I got the opportunity to work in through StepOne, I was very happy that I could do my bit staying at home for the pandemic. And since then, I'm calling the patients, and I'm quite satisfied that I'm doing my bit in the pandemic. And I would like that all the doctors could at least spare half an hour to half an hour to 1 hour per day in calling patients and helping them out in their homes so that their anxieties can be allayed and they can be helped out. So all those doctors, I would like them to just give a missed call at 080-4719-2219. So they could just help a few patients a day, and that will make a lot of difference.
Thank you, Dr. Gitanjali, for sharing your experience. Dr. Nilima, your experience for our audience and your family and friends.
I think joining StepOne was an amazing decision on my part, because I think I've made so many new friends. I've had opportunity to interact, and as Dr. Gitanjali said, I also learned a lot. And other than the fact that the feel good factor of helping others is there, I think there's one more very strong motivation for me to ask other doctors to join StepOne. And that is, when you are not a frontline warrior, if you are at home for any reason, social, personal health, or age related, and feeling helpless about this pandemic can become very depressing. Whereas when you are actively engaged in working as a back end, but still a COVID warrior, it has a definite positive impact
Yeah.
on my well being. And I feel great about myself. And I would encourage every doctor to please join our StepOne family and add to this effort. And together we will win.
We will. At Project StepOne, we have it is an impactful citizen-driven initiative, and it is always looking for volunteers to spread wider into the different networks, different states, and help the governments to bring COVID under control in India. So it is a great thing to do to volunteer for an initiative like this. And requesting all the doctors to give a missed call to the number that has been provided over here. At the same time, any volunteers, please do reach out to us for whatever help you could provide, and help India recover as fast as possible. Thank you so much, all our doctors and everyone in the audience who joined us today. Please do join us in the for our next episode, which is on 4th of November, and we will continue our discussion about home isolation and its effect on mental well-being and mental health. Meanwhile, do leave your suggestions and queries in the comments to help make StepOne Fireside Chat session better. We received a few questions that we could not take because of lack of time, but we will try to resolve these questions online on on Facebook or YouTube. And stay safe. Good evening. Bye.
Thank you. Bye bye.
Bye.